In the United States, there are constant changes in our healthcare system, and the medical field itself is constantly evolving. It's how we as a nation are able to advance our medical care and treatment plans, and a large part of how humans have evolved to live so long. There are groundbreaking discoveries every day in this topic, from newly invented medications to newly discovered illnesses to identifying new pathophysiological explanations for illnesses we've known for decades. In short terms, progress, change, and evolution is good and is the means for advancement as a society. Our healthcare system has always changed, progressed, and evolved since it's been created, which has provided great strides in ensuring our nation's civilians are as medically supported as possible. However, we've reached the point where an additional change is needed to adapt to our country's growing needs. With homelessness, financial insecurity, and economic instability on the rise, it only makes sense that obtaining health insurance coverage is difficult or impossible for some. The inaccessibility to healthcare causes a delay of care, mismanagement of chronic conditions, leading to acute exacerbations or even fatalities that all could have been prevented. This means that there are individuals dying from the impact of a lack of health insurance. If, as a society, we can see how these individuals are dying, becoming acutely ill, sustaining permanent damage to their bodies due to a lack of insurance coverage, why can't we take the next step to address this issue? As healthcare coverage has progressed, it has become generally more available to the public. Medicare and Medicaid were invented and enacted in the 1960s. Following this, private healthcare options prospered and became more popular. Decades later, in the 2000s, the Affordable Care Act was enacted in order to expand insurance coverage to those that were struggling to overcome barriers to healthcare. The Affordable Health Care Act promoted accessibility to coverage by allowing younger patients to remain on their parents' health insurance for longer, expanded access to online coverage marketplaces, and prevented insurance companies from denying patients just for pre-existing conditions. The Affordable Health Care Act did make a notable difference on the percentage of uninsured Americans and was ultimately successful in its goals. According to the National Health Insurance Survey, the percentage of uninsured Americans went from, quote, 16% in 2010 to 7.7% in 2023, end quote. However, with the unnecessary deaths still occurring, there is still more work to do. 16 years ago, our economy was a lot different than it is now, and since there has been so much change, we need to adapt to overcome this. A single-payer healthcare system providing universal coverage to Americans would eliminate the percentage of Americans that are becoming ill and dying due to inaccessibility to healthcare. In places around the world, such as Korea, that uses a universal healthcare system, it has shown a decrease in preventable deaths and deaths that could have been treated with access to health insurance, and therefore healthcare and/or medical attention. According to a 2018 article found on science.org, quote, the United States is the only high-income country without universal healthcare coverage, end quote. Preventable mortality and treatable mortality are both large concerns of our nation, and a single-payer, universal healthcare system would address this as they did in Korea. Some patients with chronic conditions, such as diabetes, have died or become severely ill trying to ration their medical supplies and/or medications such as insulin. Other patients have died, become disabled, or severely ill due to a delay of care, which could have sourced from a multitude of reasons associated with our current health insurance system. High deductibles, copays, out-of-pocket costs all deter patients from seeking medical care. It's not only the uninsured being affected, and at no fault of their own, as generally the patient would have presented to care sooner if the financial burden related to health insurance was eliminated. Having universal accessibility to health insurance coverage through a single-payer system would eliminate this aspect of not being able to afford health care, therefore eliminating the aspect of dying due to not having access to health insurance.